Okay, this is part 6 of the book review of Solving the MS Mystery. I think this is going to be the best of the 6 parts because I'm going to put it all together into this talk. It's going to be a little longer, but it's sort of, I'm going to answer the question everybody's asking. Everybody keeps asking me, what do we do if we extract a tooth? You know, what should we replace it with? I'm going to go into that in this lecture here today. All right, so first of all, he says that fluorescent light contains mercury. Fluorescent light is bad for you. You really don't want that. The best light, you know, in the daytime, blue light activates our circadian rhythm. We're programmed that way because of the sky blue to tell us it's daytime for our circadian rhythms and stuff, day-night cycle. Red light you can put into a cage, let's say, with animals for nocturnal purposes, sleeping nocturnal animals, but fluorescent with the mercury can be toxic to you a little bit in that way. It's best to not have any fluorescent lights in your home. If you're able to control the lighting at where you work, it's best to not have any fluorescent lights. You know, the old incandescent lights were better. The LED lights also have too much blue. Same with computer screens and cell phone screens. Okay, but anyways, the reason I mentioned it was other sources of mercury, fluorescent light. He thinks it's good to wait about 45 days between dental procedures. He explains a detailed description of how you remove amalgams. There's a whole bunch of safety precautions you take, like putting a rubber dam around them, you know, having a nasal oxygen for the patient, you know, gas masks for the dentist and the dental assistant. Aluminum is found in about 1/2 of the composites that are used to replace amalgams, or more than that, okay? And this is associated with many patients being worse off than they were before for removing amalgams. I'm not saying you should always remove amalgams, because if you've had them a long time, you know, a lot of the mercury has already come out of them. Maybe you're tolerating them well, and then what are you going to do? I'm going to get into that in a little bit. Root canal procedures are far more devastating than amalgams. Patients like root canals because they don't have to remove the tooth. The dentists like them because they can place crowns and bridges on them, and they maintain a higher number of the original teeth, and of course they make money from the procedure. Pain is the main reason for doing root canals. Usually there's two options, either do a root canal procedure or extract the tooth. That's the most common option in that setting. Root canal tooth is a dead tooth. Root canal procedure saves the outer tooth, but it might kill the patient. Okay, you can see these really smart old dentists, they don't like root canals. Okay, root canals are always infected, including the periodontal ligament, PDL. That's an important word, periodontal ligament. We'll come back to that. Bacterial change from aerobic to anaerobic, and that's called pleomorphic change. They release more severe toxins. The toxins are worse from the anaerobes. Rosenau and Weston Price were friends and colleagues. They found if they removed a root canal tooth from a diseased man and implanted it into a rabbit, the rabbit would routinely get the same disease as the man had, you know, like kidney failure or heart attack, something like that. They actually took the root canal removed tooth from Weston Price's son, a 16-year-old who died. So Weston Price, he was a genius dentist, and he was so sad that he devoted his life to studying, you know, what really happens with root canals and amalgams and stuff, and he came to the conclusion they're both really bad. And he implanted the tooth that had killed his son at 16 years old with a heart attack, and he put that in 100 rabbits, and he claims they all died of heart attacks. So, you know, I'm not sure why. Prothrombotic, perhaps. A few weeks before he had died, Weston Price gave his books and his papers to Hal Huggins to teach the rest of the world about them. And that shows you what he thought of Hal Huggins, okay? That he had the highest opinion of him. Okay, Weston Price is like probably the greatest dentist who ever lived, and Hal Huggins is probably number 2. Okay, regular x-ray routinely looks normal even if there's a major infection. It's not that good. Cone beam CT is much more sensitive for showing periapical infections at the tip of the root within the bone of the jawbone, the mandible, or the maxilla. Condensing osteitis is when there's a sclerotic reaction around the outer surface of the tooth root, and it's actually a bad sign. Sounds good, but it's not. Okay, continuing with this book here, cavitations are a common problem. That's like when you get a residual infection, you've left a little bit of the tooth root inside, and the periodontal ligament that's infected, and you get this persistent infection, and it'll infect the bone of the jaw. You'll get a jawbone osteomyelitis, mandibular osteomyelitis, or maxilla. Maxilla is the upper jawbone, maxillary osteomyelitis. Properly done, the periodontal ligament must be removed. That's what you need to know. If you're going to get your tooth removed, you got to tell that to the dentist because they won't do it automatically. The dental schools say leave it in, but that's stupid. It's like leaving in the placenta after childbirth. Okay, all these numbers here are page numbers from this book, so if you end up wanting to read the book, you can look this stuff up real fast. Many dentists are not even aware of cavitations. X-rays can't see them, routine X-rays. You can see them with the naked eye, Regular CT can't see them. After clearing out a cavitation, it's good to fill the spot with a blood clot. That helps it to heal better. The patient shouldn't drive more than 3 miles after this dental appointment because otherwise the blood clot can get dislodged and that doesn't heal as well. You can end up with a dry socket. To detox, you can't remove all the mercury from your body. What you want to try to do is have more mercury going out of your body than coming into it every day. And one of the best ways to do that is to sweat a lot. He even likes saunas. I would just exercise a lot, dress real warm. I routinely wear a sweatshirt and a t-shirt under my regular clothes because I want to sweat more. Therapeutic phlebotomy is a way to get the excess free iron out of your body, lower your ferritin levels. I like to keep my serum ferritin about 30 to 80. It's actually not there yet. I've got it down to about 110 last time I checked. It used to be much, much higher for me because I used to eat Raisin Bran cereal all the time, which is really high in iron when I was young. But you don't want all that free iron roaming around because it can end up causing problems, the Fenton reaction, which can cooperate to have a synergistic effect, damaging effect on your mitochondria. So you don't want that. He says glutathione IV can help remove mercury. Of course, the best thing is NBMI, but they don't allow it. That's the Boyd-Haley chelator for mercury. Hal Huggins amalgam and root canal removal procedure. It's in this book on pages 320 to 337. And so if you're going to go to a dentist for it, you're going to want this book. It's a great book. And you can go over that with your dentist to make sure they're doing everything right. Go to IAOMT.org, that website, International Academy of Oral and Medical Toxicology, because they'll show you the dentists that are trained in the proper way to remove amalgams. The dental motto is drill them, fill them, and bill them, and then Hal Huggins adds, and kill them slowly from these toxins. Okay, now here is an example of one of the things you can put into the tooth socket when you remove it. You can use this temporary denture here. It's called a flipper, and you can just flip it in and out of the tooth socket. And for cosmetic purposes, that'll look nice rather than having an empty tooth socket. So far, out of all the dental materials I've studied, my recommendation, what I would do for myself, is leave the socket empty. And the reason I say that is every time I read in more detail, I look at the fine print, or the medical data safety sheets, okay? These things, medical safety data sheets, MSDS, the more close I look at these things, the worse these things get. Dentists don't know toxicology. They really don't at all. Like I said, the composites, doesn't that sound great? But then you find out it's 45% aluminum oxide. Aluminum is a major brain toxin. I don't want that in my mouth. And Hal Huggins himself says, that's why a lot of patients don't get better. You remove their amalgam and then you take the mercury out and you throw aluminum in there. It's like just trading one brain toxin for another. That's not smart. He thinks it's good when you first remove a tooth, start out with replacing the site with a flipper, just a partial denture. So you take it out at night. Something that's called a partial or a temporary means you take it out at night. He says also, don't even get the plain one. Don't even get the ones that are painted. He says the paint will often have acrylic in it and cadmium and mercury. So again, you're out of the frying pan into the fire. Simple is better. Don't worry so much about cosmetics. He says let the site heal 3 to 6 months. He says you're not going to get pure plastic because pure plastics alone, they're just not that strong and they're not routinely available, according to him, when this book was written. I think this book was written a long time ago, though. It was written in 2002. So there might be better ones available. Yeah, 2002 is the copyright. So okay, what causes MS? He says you can get it from root canal procedure and amalgams commonly, rarely from titanium implants, and super rarely from whitening of teeth. That might even be bogus, that whitening of teeth thing. But he does say he's seen it twice in his long career. He started practicing in the 1950s, kept going. He died around 2014. Okay, so here's a couple of materials I just want to show you. This is composite. It's the white filling that they stick in there. They can take out the amalgam filling. Here's an amalgam filling and replace it with the white filling. Here's what it looks like. It actually looks pretty good. These are composites, okay? But again, the problem with them is that they'll often be, aluminum oxide, 45%. That's a lot. And they can also contain, look at all the bad things composites can contain. They can contain hexane, major neurotoxin, toluene, somewhere in here, a major neurotoxin. And then acrylate, strontium, polyurethane, xylene, phenol, silane. Some of these, I don't even know what silane is. I have to look it up. But the bottom line is, this is all bad. Phenol is used to, as an antimicrobial to kill stuff. These are all bad, toxic things, all right? So, there's not great dental materials. He says, in general, composites are not as toxic as mercury or copper. You can do compatibility testing preoperatively to get an estimate of the risk. Composites take more time to make and to place, and so they're going to cost you about 50% more than amalgams apparently. He likes removable bridges. They're similar to removable dentures like the flipper I was talking about. They come out at night. The big advantage of removable partials is you don't have to destroy the adjacent teeth. Because if you're going to put in like a fixed bridge, you're going to cut down the crown. You're going to cut the crown off on the adjacent tooth so you can stick this fixed bridge in over them. Okay, so you really don't want to destroy normal teeth without a better reason. Here's a metal implant. We'll talk more about metal implants in a moment. And you could do that if you have to, but now you got metal going into the bone, and that can cause a autoimmune response from the body. Here's a removable bridge. Here's multiple implants being placed, and this one almost like a fixed bridge, again, kind of similar to this appearance here. If you get a fixed bridge, gold and titanium are the safest ones to have. Gold's very expensive and heavy, but patient acceptance and tolerance are very good. Titanium is the most biocompatible metal when it's not in the bone, but if you're going to screw drive it into the bone, then you can get autoimmune reactions to that too. Nickel is sort of like another name for stainless steel. It's the most common metal bridge. It's real cheap and it's strong, but he thinks it's a bad idea because it's toxic. I told you about ceramics and porcelain sort of being the same thing, and those containing often a lot of aluminum. So you see what I'm getting at here is a problem. Composite, major problems, aluminum and all these toxic chemicals. Ceramics and porcelain, major problem with aluminum. That's why I'm not aware of a good way to replace it. Now there might be something else. I don't know. I'm not a dentist. I'm just, I read like 5 books on dentistry. I've watched a whole bunch of videos on it. I'm trying to figure it out, and I can assure you, dentists are not that forthcoming and clear with their talks, their lectures, or their books. They're kind of all over the place. I think most of them have mercury poisoning in their brains, and they're a little impulsive and crazy. Okay, so it's not that easy to just open up a dentistry book and get the answer that you want. I wish it was. This is the best dental book. The second best one is Robert Gamal's Garbage Collector book. They're both very good books, and these guys are both brilliant, but there's a little bit of mercury on board with Mad Hatter, and their books are not as well organized as I would like for figuring stuff out. Okay, the root canal, we talked about it. Here it is, the procedure. You got an infected tooth, damaged tooth, little abscess, periapical. So they root it out. They try to suck all the infection material out, but they're not able to. And then they fill it in. They put some toxic chemicals in there in an attempt to sterilize it. Then they fill in gutta percha, which is sort of like wax, and it's really like latex, like a plastic. Some people are allergic to that. They should do compatibility testing first, but they usually don't, and some people have an allergic reaction to it, rarely. And so a root canal tooth, it looks like it's normal on the outside, but it's a dead tooth. There's no artery or veins or nerves going into it or lymphatics, so you then have this infected tooth and the immune cells can't get to it. So that's bad. So those infections linger forever. Implants, nickel, titanium, other, like I said, ceramic with aluminum oxide in it. You drill into the bone. And titanium is well tolerated in the body, but not as well once it's drilled in the bone. But it causes less artifact on MRI. That's another reason why it's popular in comparison with, let's say, the old stainless steel type implants. This is just showing the progress of a cavity. It goes from being in the enamel, an enamel cavity. Here's one where it's now extended into the dentine. And here's one where it's gone from the enamel to the dentine into the pulp space. And then here's one where the infection is spread through the pulp space down to this is the root, and here's the root apex. So this is a periapical abscess. Peri means around, dont means tooth, itis means inflammation or infection. So periodontitis means an infection around the tooth. And on a CT scan, we'll often see lucency in the bone from destroyed bone. Infection of bone is osteo. So the word is osteomyelitis. That means infection of bone. So periapical lucency on CT implies osteomyelitis. Here's a nice picture of it. You can see the tooth. You can see this cavity with the infection having spread downward through the tooth pulp, down into the root apex, out the root apex, into the adjacent bone, into the mandible. And there's your little infection, your little abscess in the bone. And they need to clean that out to help cure it. You might have a hard time getting antibiotics into the center of an abscess. Okay, here's just showing a more extensive infection where you've got an abscess in the mandible and the jawbone. Okay, destroyed bone, necrotic bone, dead bone, and it's damaging the nerve that runs through the mandible. Okay, so that's like your trigeminal nerve. Okay, mandibular branch of it. Here's just showing some infected bone on a resection specimen. Here's showing an x-ray of the tooth, and you can see there's periapical lucency on this x-ray. Here you got a minimal periapical lucency. Here you got a large amount of periapical lucency. Here you got a normal periapical region. All right. Now here's showing like a cone beam CT, and there's some lucency in this area which is thought to be an infection. All right, here shows a tooth extraction. You got extraction forceps, you pull the tooth out. Here's a periodontal ligament. They really need to scrape that out. Okay, like I said, that's the PDL. That has to be removed. Otherwise, the infection will tend to linger in there and then reoccur. The best thing to do after a tooth is removed is fill it in with a blood clot. And they recommend you don't travel in your car more than 3 miles after this, or sit in the office for a couple hours to let that blood clot get healed in solidly, because if it gets dislodged, then you have an empty socket, and that can be painful and difficult to heal. Okay. All right, so anyways, that's all I've got for finishing this review. Solving the Multiple Sclerosis Mystery by Hal Huggins, a great book. And the big discovery here was a lot of multiple sclerosis and other neurologic disease comes from root canal procedures because they're always infected, and dental amalgams because they're 50% mercury. And if you remove them, the patient has a good chance not to progress or to get better. But I still think most MS is due to the diet stuff of Swank and McDougall with leaky gut, autoimmune, antibody cross-reactivity, and that's treated best with diet. But it's good to know about this, so patients who don't respond to diet, you don't give up on them, and you try removing these teeth, and you might have a good chance to cure them. So it's certainly worth a try.